We're going to go live right now to Health Minister Sylvia Jones, who's making an announcement. Let's listen in.
To be back here at Women's College, and good morning. I'm really excited about today's announcement and thrilled that I'm being able to be joined by my colleagues, of course, Minister Bethlenfalvy, Minister Williams, MPP Kusindova Bashta, and of course, my two parliamentary assistants, MPP Don Gallagher-Murphy and Robin Martin. This incredible facility has been a leader in world-class healthcare for over 100 years. And on behalf of Premier Ford and our entire government, I want to thank the entire team at Women's College for what you do to deliver convenient and connected care to Ontarians each and every day. I also want to thank Sherry Wilcox for joining us today and being prepared and willing to share your story with us. Under the leadership of Premier Ford, our government has been making record investments in healthcare. Through our Your Health plan, your government is taking innovative and bold action to build a more connected and convenient healthcare system by growing our healthcare workforce, reducing wait times, and expanding access to key services to improve the health outcomes for all Ontarians at every stage of life. And today, we are taking another important step to ensure Ontarians can access the care they need when they need it. I am pleased to announce that our government is lowering the eligibility age for publicly funded mammograms from 50 to include those aged 40 to 49. This change, of course, will allow for up to an additional 1 million Ontarians to self-refer for a mammogram if they decide screening is right for them. Nearly 12,000 Ontarians are diagnosed with breast cancer each and every year. We know early detection through regular screening with mammograms can save lives, detecting breast cancer before it has the chance to spread. And with this historic expansion, more mammograms will be performed each and every year, ensuring breast cancer is caught earlier and treated sooner. Those eligible are encouraged to have a conversation with their healthcare provider to discuss their risk factors, family history, and benefits of breast screening and determine what is right for them. Our government continues to take bold action to strengthen our healthcare system, to resume the work that began prior to the pandemic to build a healthcare system that is both responsive and evolving to meet the needs Ontarians can need and expect to connect more people to care closer to home. I also want to thank our healthcare partners like Dr. Jacobs and the entire Ontario Association of Radiologists who are here today. We are grateful for their partnership and advocacy, which made this exciting announcement possible today. And of course, to Women's College Hospital for your leadership and for hosting us today. It's now my honor to pass it over to Minister Bethlenfalvy. Thank you. Stay on.
Well, thank you, Minister Jones, and it's great to be here. I've come a long way from the Frost Building, which is right across the street, but it's such an honor to be here and participate in this very exciting announcement during Breast Cancer Awareness Month, alongside my great partner, Minister Jones, who sits beside me in the House, and we don't get too many questions, so we spend a lot of time talking together. Minister Williams, great to see you. What a great champion for women. And the fantastic parliamentary assistants to the Minister of Health, Don Gallagher-Murphy, and of course Robin Martin and Natalia Kusindova Bashta. Grateful and honored to be here with you today. And you know, folks, they're all champions for what we're announcing today, because many have been affected in their lives by breast cancer. This devastating diagnosis causes untold physical and emotional burden and significant pressure on our healthcare resources. Nous avons tous, d'une manière ou d'une autre, été touchés par le cancer du sein. Quand on le diagnostic dévastateur, il donne lieu à un indescriptible fardeau physique et affectif, en plus d'exercer des pressions considérables sur nos ressources en santé. Our government gets it. And that's what why we're expanding the eligibility for breast cancer screening. So that's starting, as was mentioned by Minister Jones, starting in fall of 2024. People aged 40 to 49 will be able to self-refer for a mammogram. And you know, all of us have a mother. You know, every single person on this planet has a mother, and this is such an important day for all the mothers and the daughters, sisters in this world. So I'm very proud to be with my colleagues here today making this announcement. Without the need for a referral from a family doctor or other primary care provider, this is game-changing. Make no mistake, this is a measure that will save lives and make the health care system stronger. This is just another way our government is building a more connected and convenient healthcare system for the people of Ontario. So through that plan, pharmacists can now prescribe treatment for 19 common minor ailments. The backlog for surgeries has been reduced by more than 25,000 from the peak in March 2022. And I want to congratulate you again at the Women's College here, who do remarkable work helping people's lives. The people of Ontario can have confidence that we will continue to provide better services for you and your family. This Thursday, I will release the 2023 Fall Economic Statement to provide an update on our plan for building a strong Ontario. Jeudi, je déposerai l'exposé économique de l'automne 2023, qui fera le point sur notre plan pour bâtir un Ontario fort. This update will continue with our government's targeted, responsible approach, so we have the flexibility needed to get through this economic uncertainty while laying a strong foundation fiscally for future generations. We know that the economic uncertainty that surrounds us is a challenging time for many, as well as geopolitical challenges right around the planet. But we should all be confident in Ontario's economy, its workers, and its people. And we have seen what the people of Ontario can overcome when we work together. Together we can build a strong Ontario, and with that, it's now my distinct pleasure and honor to welcome Sherry Wilcox, a champion for patients, to the podium.
We've been listening to Finance Minister Peter Bethlenfalvy alongside Health Minister Sylvia Jones making an announcement at Women's College Hospital.